welcome. I'm Alison Gowman, the chair of Livery Climate Action Group, and this is one of our regular meetings of the SPOCs, the single points of contact for the 107 members of the livery companies and other organisations. And as you know, the way of working this year is that we're actually having presenters rather than just having a free-for-all chat. And I'm really delighted today that we've got two SPOCs from two of our members who are going to be talking about their topics. They're not directly related, but as we were just sort of chatting about in the preamble, you know, there is so much wealth of knowledge and understanding that actually everything is interrelated, as we know, with climate matters. So we're great to welcome you all. So we're going to split it effectively into two halves. The first half is going to be David Bates, and the second half with Jonathan Louth. Both of them do have presentations on the screen. We hope will work. Yeah. So David, if you want to start putting up your screen while I just do you a brief introduction, because there's always that nervous moment that it won't work. David Bates is the middle warden of our newest livery company, the Worshipful Company of Nurses. So it's fantastic again that they're a member and also that they're contributing in this way. And David's interest is very much around green health, and I might say climate impact of health, but he's calling it green health in the wider planetary health agenda. He's been a health advocate in the army, in the armed forces, and has an extensive career as a burns trauma nurse and various other things. I won't perhaps extend too far into that. And what's really fun, he's up in Cumbria, so that's the brilliance of these online events, that we can be hearing from people all over the place. So David, are you ready to put your screen up?
Good evening, Chair. Good evening, everybody, colleagues. What I've been asked to do this evening is to talk through what we've been calling greener health, but as you'll see as we move through the presentation, that there are several other definitions for this, which are similar, but not exactly meaning the same thing. So what I thought might be useful would be to go through some of the recent history of health and its relationship with sustainable development and climate action in specifically, and then look at ways that in the public health domain, as opposed to the healthcare domain, we've been cooperating with not only the health community, but the wider community, when we talk about the wider determinants of health and the agencies and the organisations which have roles and responsibilities in those areas. That's what I intend to cover in the next 20 minutes, and we'll just move straight on from there. So I did say that we'd talk about public health, but I'd started with health purely because these are all the areas that the climate action people identify as health having an impact on. When you look at healthcare, we've got this example here from the King's Fund, where they're talking about healthcare itself. So most healthcare takes place in buildings with lots of infrastructure, logistics, and the little cartoon there demonstrates that the carbon dioxide emissions alone are attributable from the NHS to for more pollution than Heathrow Airport across the country. Talking about the National Health Service and not public health itself, but just using this cartoon here to demonstrate that there's more emissions from hospitals and health care organisations and functions than are emitted from a year's work at Heathrow Airport, which is really interesting, and which places the emphasis on the health end of the spectrum to actually try to do something about this. But we'll see more of this as we go along. And the other aspect of this as well, I can't remember when General Nuji came to talk to us. He was talking about sustainable development in the military and in warfare operations. But what we're increasingly finding is that if we get health and care right, then that's a major contribution to human security and global security. So again, what we're trying to do is to use the preventative end of the spectrum to try to prevent conflict and to prevent warfare. But having said that, what we're seeing at the moment is not really demonstrating that as a success. But again, we'll go through and I can try to rationalise this. This is some of the mitigations that the NHS, if you go on the NHS website and their sustainable development website, they'll talk about transformation, as they always talk about transformation. But if you just sort of scan through some of those actions there and interventions, there's not a lot that I see there which is transformative. It looks a lot transactional to me. I'm just a bit skeptical about some of the strategies that we're offered. So I said I'd talk about some of the development work, which has been going on for years, and all the way back to the late 70s. Alma-Ata, which is now Almaty in Kazakhstan, which is where the WHO held the first Health for All conference all those years ago. The health dividend was supposed to have been funded from the success of the SALT treatments, so the SALT treaties, so the strategic arms limitation talks between the Allies and the Russians. But of course, that never came off because the Russians invaded Afghanistan. And the money that should have been saved on nuclear weapons, the descaling of nuclear weapons, it never came to fruition, never materialized. So 10 years later, that was taken one step further, and a health promotion conference was held in Ottawa, which is where that's really where the birth of greener health and planetary health came from, because it was recognized again that without health you can't have security, you can't have global security, human security. And so a big emphasis was put on that, and the Ottawa Charter was written and promulgated and published, and it's still used today. It's actually stood the test of time. The only time, or the conference where it really brought everything together was the Sendai conference in 2015, which is the United Nations Disaster Risk Reduction Series, started in Yokohama at the beginning of the 90s. Followed by Hyogo 10 years later, and then by 2015, that's when we had the last of the disaster risk reduction conferences. And that's when sustainable development, climate action, and disaster risk were brought together. And obviously, there's going to be a health component. So that's they're the major milestones in the history of not only global health but also in disaster risk reduction. So to bring it back to health, and we were talking about this before we started, that the wider determinants of health are as important, if not more important, than actually those interventions that are delivered by health professionals and healthcare professionals. Within this is called the rainbow model. You've got different elements of society, like education. You'll have architecture in there, you have building, there's water conservation, lots and lots of different functions that society needs to exist. So if they're not coherent, well, we've got another model over here, but that sense of coherence, if we don't have coherence within that, then society breaks down, either through disease or through conflict or catastrophe of other sorts. Sort of fused with Antonovsky's model here, which is the upstream intervention, as a waterfall with a cascade, a cataract. You can bring those two together and demonstrate that it's better to look upstream for preventative interventions rather than waiting for society to break down, everybody to become ill, and then we have to look at picking up the pieces in hospitals and tertiary care centres further down the stream. And I actually got this from the Local Government Association website, which was really interesting because I was looking at examples because I knew that Jonathan was here, and I was looking at architectural examples, town planning examples, which we have spoken a lot about in LCAG previously, and it was good to actually see this cropping up on that website. So it does show that these conversations we're still having these conversations, and it's still at the top of some people's agendas. And just to illustrate that treatments start down here and not up there, curative treatments, and then these what we call secondary protection or secondary prevention, like vaccines and diabetes therapies, not therapies, but preventative interventions. So I was asked to focus on so what for the city and for the livery. And of course, previous Mayor Sir William Russell set this challenge back during the heady days of COVID. We've got a call to action there, which we certainly have stepped up to. And a number of our peers also do, either through our CAPs or through working or operating independently by joining different groups which are interested in or have roles and responsibilities in climate action, responding to climate change or sustainable development. And the pollinators always get used as an example, but there's many more than them. And I also thought it was interesting, our next conference, Are We Prepared, in the new year? And actually, when I was researching this, there's actually a lot going on within LCAG and within the livery. And I thought this was I was listening to a podcast called Not Only the Tudors, and it was about a what if. So if Guy Fawkes had blown up Parliament back during James I's reign, what was the what if? And they looked at the city, they looked at London, and they said, well, London would survive because it always does, because it's robust, it's resilient. And it did. I mean, it survived the Black Death, the plague, the Great Fire, the Civil War, the Blitz. So there's lots of examples there of how the city has been successful and probably will be in the future. And sort of linked to that, I was in a webinar this afternoon at Chatham House, and it was really looking at what's going on or what's on the global landscape at the moment. And it took me back to when we were talking about the chronology and how we got to where we are now, and how conflict politics has either caused friction and slowed down progress, or has even reversed it in some places. And I won't go through these in detail, but these are just some of the consequences of what the decisions that are being made in America at the moment, in the States at the moment, not America, the United States at the moment, by the Trump regime, and how they're influencing global health, in particular the poorer countries, the Southern Hemisphere. And so all of the progress that we've made in equity and equality across health, again, is being eroded because resources are being taken from people that really need them. So this could be a direct threat to the whole strategy of planetary health or greener care. So what is planetary health, and what is the livery role as we wrap this up? As I said, planetary health had evolved going all the way back to Alma Ata and the WHO conference, and it sort of came through various iterations itself. So 30 years ago, when I was a lad, we were talking about the One Health concept, which was basically bringing environmentalists, veterinary healthcare providers, and human healthcare providers together to work together in concert so that we can improve biosecurity at home and abroad. That morphed into global health, which is what we see here. And then planetary health was just bringing everything together. So a bit of a scary diagram, but you can look at that in slow time, in your own time, and hopefully that will give you an idea of what we're trying to achieve. So I already said some of this, what can the livery do and what can the city do? And as I said, I think we've got a proven track record already, and we've proven buoyancy and resilience. So buoyancy and response and resilience in recovery. It's always had strong leadership and proven leadership. The liveries are creatives, and this is what I'm finding studying public health at the moment, is to be a public health doctor or practitioner or nurse, you've got to be a creative and you've got to be a polymath. So going back to the wider determinants of health, if we don't understand the sciences, the humanities and the arts, we can't actually do the job, because we're going to miss something. And that's particularly in leadership and development. And we've got this commitment. And I was only looking through the general development orders from last week, And I was pleased to see that there were two ecological, environmental orientated requests in there for environmental greening and agreement on an ecology management plan, which I thought was really good. And lastly, how do we actually embed this into everything we do? Because I think it's all about attitudes rather than physical and even conceptual. So it's trying to develop or draw out the moral component of learning and understanding, which is this bit here. And it's all based on this philosophy of social reality, and that sense of place where we live and what we need to do to improve it or to even maintain its function. And that's where this transformative learning, capability development and leadership model comes from. And it's all about, as I say, sense of place. It's the community, culture, context, and also including the people that live there in the planning. So rather than imposing planning and change on communities and on populations, we actually involve them in that process, which is what that's telling us down there. And it's fusing all of these: training, education, but also importantly experience, and that's experience of the public as well. And another scary diagram to finish on, but this is the strategy for the Worshipful Company of Nurses Climate Action Plan, which we're hoping to deliver in January after our court on the 22nd. So we're really pleased about that. And I think that's it.